Talking about it all morning. October, a lot of you know, is Breast Cancer Awareness Month. It's also Sudden Cardiac Death Awareness Month as well. In the U.S. today, nearly 400,000 people die of sudden cardiac death. Dr. Campbell here this morning to break it all down. Doc, good to see you.
Good to see you, Phil.
So, not to be confused with heart failure, right? Sudden cardiac death, a little bit different than a heart attack.
Right, so sudden cardiac death is when we have a bad heart rhythm from the bottom chamber of the heart called ventricular fibrillation that no longer allows us to pump blood to the body. The brain dies, the rest of the body tissues dies. It is absolutely the #1 killer in the U.S. today.
And my understanding is that a recent report was done talking about the importance of CPR, right?
Landmark study published in the Journal of the American Medical Association this past week. It was in Denmark. Over a 10-year period, they looked at rates of bystander CPR. Me and you on the street, somebody collapses, we do CPR.
Right.
The rates initially, at the beginning of the study, were only about 20%. They went to 40%. Survival rates in those 20,000 patients went from 7% to 22%.
Wow.
Triple the survival rate, which is huge.
Just from folks knowing CPR.
Just from pumping on the chest.
Other than CPR, what else can we do to help save lives?
If you remember, we did a story on AEDs,
right.
automatic external defibrillators. That will increase survival rates up to almost 70%. When you learn CPR, you learn AED use. And in this study, AED use did not really increase because that was not a point of emphasis. So I would say if we can learn CPR here locally and regionally and AEDs, we're going to have a much better survival rate in these patients.
Yeah, the numbers start to skyrocket, right?
Exactly.
What if you're a survivor? I mean, what can you do? What's next for you?
If you're a survivor of sudden cardiac death and you meet certain criteria, you come see me, and you need an implantable cardioverter defibrillator, which is a defibrillator that we put inside the chest. And when I'm not on the couch here with you at WNCN, that's what I do.
Right.
And these devices watch every beat of your heart rhythm. And if you have a dangerous heart rhythm, it will shock you and save your life.
Running out of time here. If people want to learn CPR, a lot of ways to do so, right?
American Red Cross and where I work at Rex Hospital, there are classes. We'll put it under links you mentioned today so that everyone can sign up and learn CPR.
There you go. Doc, I just got smarter. Thank you, sir. Always good to see you. And if you have a question for Dr. Campbell, really easy. Log on to our website, WNCN.com. Search links we mentioned. From there you can like Dr. Campbell's website. You can also like his Facebook page and hit him up on Twitter.